Hello, my name is Dr. Allen. I'm an anaesthetic consultant here at Moorfields Eye Hospital, and today I'm going to show you how to make a simple, cheap, yet effective model for training Sub-Tenon's anaesthesia. And all you need to achieve this is a number of items which can be easily picked up in any operating theatre. These items are a pair of surgical gloves, some scissors, a couple of cardboard drug trays, some sticky tape and a pen. To make the eyeball, you would first of all take the sterile glove, and there's a number of ways that you can achieve this, but a simple method we have found is by taking one of the gloves, opening it up, passing the fingers back into the hole of the glove, and then continue to wrap it in on itself. And what you're trying to achieve is you're trying to make a very tightly packaged rubber ball. If you continue to roll in on itself, that is what you get. Now, if that stays there by itself, all well and good. If not, you could put a little piece of sticky tape onto the back just to hold its position. Once you've made the eyeball, what you want to do now is move on to make the layers of the eye. And these layers are the conjunctiva, which will be the superficial layer, and also the tenons, which is the deeper layer. And to do this, you take your other glove, and using a pair of scissors, you want to cut at the level of the fingers, and what you'll end up with is a double layered tube. So you can discard the fingers, and all you have left is a double layered tube, like so. And as I said, this will become the conjunctiva, which will be the superficial layer, and the deeper layer will be the tenons. Taking the double layered tube, you can now place the eyeball into the centre, hold it in place, and then twist it around to make a stalk. Once you've made the stalk, take a piece of sticky tape just to hold that into position. So there you have your eyeball. Now it's important to note that the double layered tube on top has two different ends. One end which is free, you've got two different layers which are very obvious, and the other one which contains the reflection, and it's this layer that you will be attempting the Sub-Tenon to block on. Once you've got your eyeball, you now want to hold it in place, and to do this we use a couple of cardboard trays. I found by using the centre ring of a piece of elastoplast, you can actually get a good template. So draw in the centre, and that template will approximate to the size of the eyeball. Then you want to create the hole using a pair of scissors. You may want to get your adult helper to do this. And very carefully expand the hole. Until you have something like that. In order to facilitate the passage of the Sub-Tenon's needle, it's important to create a little alcove. So by making a triangular cut in the corner of the paper tray, like so, you will have ample passage for the Sub-Tenon's needle to pass through. Finally, you can pass your eyeball through the hole, and it's held in place like that. So there you have your Sub-Tenon's model. For realism, you can take a pen and create a pupil and an iris, and for even more realism, we've created a model with an eye cut out, a face with an eye cut out, which you can pass over like so. And there you have a Sub-Tenon's model ready for use in training. Right, so now I'd like to actually demonstrate how we would use this model. Just to very quickly recap, we have our eyeball, which was created from one of the sterile surgical gloves and was wrapped upon itself to create this tight ball. This ball is then placed into a double layered ring which we created from the other surgical glove. And I think it's important just to remind you that we have two different ends here. There's an end which was cut, which is the side we won't be using, and there's the end which has the reflection of the glove, and this will become the inferior nasal part of the eye. And then of course we have our structure for holding the model, and this is two cardboard trays with a circular hole cut out and a recess to allow passage of the Sub-Tenon's needle. So now I'd like to quickly demonstrate the model. Picking up the forceps, we're going for the inferior nasal quadrant. We will pick up both the conj and hopefully the tenon's layer and make a small snip. And there I can see both layers quite clearly, the conj and then the tenons underneath, and also the sclera of the eyeball behind. I'll then take my Sub-Tenon's needle and very carefully and gently place it into the Sub-Tenon space. And that feels very realistic, like performing a real Sub-Tenon's. You then want to inject, and there's a small amount of resistance, but the liquid is passing very nicely. If you only go through one of the layers, that's the conj, then the needle will not, of course, pass because it will come up against the reflection and you won't be able to inject like this. Confirmation of your block is confirmed by the liquid, which is passed underneath. So there you have what I think is a very simple yet effective way of demonstrating Sub-Tenons using a few materials from the operating theatre. Thank you for your time.